Good morning, everyone, and welcome to the 9:30 call. We're going to get started in about 2 minutes once everyone joins from the waiting room. Hi, Maya. Hi, Julia. We're going to get started in about 2 minutes once everyone joins from the waiting room.
Thank you.
And Marissa, the task force report is out. So I was going to put those links in the chat unless you were.
I was thinking the same thing, yeah. So I can get
Great.
started with that now just so we don't take up too much of the time for our friends from the Department of Public Health. But this is a great meeting for the 9:30 call today where we're hearing from Maya and Julia from the Department of Public Health. And it's well timed because yesterday Governor Healey's interagency task force released their year one report. So there's a link to the recording of the event, which I believe was held at Ellis Early Learning, the report itself, and then the press release from yesterday. So we can put all that in the chat just so you all can take a look at that. I'm sure we'll talk about it next week when we're back on the 9:30 call, but we are so excited to have Julia and Maya from the Department of Public Health here today to talk to us about their 5-year needs assessment for Title V and some of the work that they're doing to hear from early childhood across the state. So Julia and Maya, I'll turn it over to you. We always ask our 9:30 callers to tell us a little bit about you and how you came to be in your current role, and then you can go ahead and jump right into the slides and presentation.
Great. Thank you, Marissa. So just real briefly, hi folks. My name is Maia Raynor. I use she, her pronouns. Um, Currently, I work at the Department of Public Health, Bureau of Family Health and Nutrition, where our state's WIC program, early intervention program, and a host of other services and supports for families live. I ended up in that space. Previously, I'd been working as a doula, working with families directly. And yeah, just wanted to do something a little bit more upstream, so that families were getting the supports they needed before giving birth, or so they were able to access supports in the postpartum period. And I'll pass it over to Julia.
Hi, everyone. It's nice to meet you. I'm Julia Zubiago. I use she, her pronouns. I'm a program analyst on the Title V team working under Maya. Um, I've bounced around a little bit. Mostly my background is in um, identifying barriers to healthcare and supporting program development to address them. I worked in infectious disease for a little bit. I worked at Mass Health and their addiction services team for a little bit, and then was working at Beth Israel Lahey Health and implementing some of their health equity work before coming here. Um, and so I've been supporting the like stakeholder engagement piece, and interested in thinking about like how do we make systems work better for people. Um, yeah, and really grateful that you're having us for today. I'll pass back to Maya to talk a little bit about like what Title V is, and then I'll talk about the needs assessment process.
Yeah, great. So definitely don't expect everyone to have heard of Title V. It's one of, in my opinion, one of the lesser known sort of federal grants that we have. So it is a block grant, a part of the Social Security Act. It's been around almost 100 years, and all states and territories in the United States get funding for the federal government to support the needs of birthing people, young children, and there's a particular focus for this funding for children and youth with special health needs, which we define really broadly to include children and young people with medical complexity, intellectual and developmental conditions, as well as behavioral health conditions as well. Um, So, yeah, Title V's vision is really focused and centered on improving systems of care to improve the overall health of families. And the way that we do that is looking to put that funding to support and expand public health systems and services. So that looks like our universal home visiting program, that looks like supporting our care coordination program, making sure that people have what they need to access direct services. Some of the other programs right now that Title V currently funds is our state's Poison Control Center and hotline. We also do a lot of work related to, as I said before, children and youth with special health needs. Yeah, so with that all said, Title V works on a 5-year cycle. And Julia will talk a little bit more about the needs assessment process. But essentially, we develop a state action plan every 5 years, and that isn't inclusive of everything the department is doing around maternal and child health, but it's really how we center and strategize about what are the Title V priorities that will get additional support for collaboration across the department and across partners externally to the Department of Public Health as well to make meaningful change. So I'll pause there and pass it to Julia.
Do folks have any questions before I start sharing my screen?
I'm seeing you in the chat, and thanks for putting some of the information in the chat as well. So if you're
Yeah.
joining now, we can add some more detail about what Julia and Maya are here to share with us today.
Okay. All right, let me share my screen. Oh no, it's minimized. Hang on. Okay. Can you guys see the slides?
Yes, we can see them. It's still in sort of the, there we go. I think it's entering.
Okay, great.
presentation
I
mode.
just wanted to, I wanted to check I was sharing the right thing before
That's
I
always
like
the
made the
hardest
screen big and then I was like, oh no, I can't find anything. All right, so Maya talked about what Title V is, and so I'm here to talk a little bit about like what why we're talking to you. And so part of the Title V reporting cycle, like Maya said, it's a 5-year federal block grant. And so part of the ways that block grants work is that the money comes from the federal government and then the state is expected to do a needs assessment, um, where we engage, like look through the data at the state level and engage with stakeholders in order to identify 7 to 10 priorities for improving maternal and child health. And so it's really important that we're engaging with as many stakeholders as possible, people with lived experience, like families, people who work in the field of maternal child health, including kids with special health needs, and making sure that the things that we at the Department of Public Health are thinking about like actually match what you're seeing in your work. And so after we've identified those priorities and gotten feedback on them, Maya and I will take that feedback to the rest of our team and we'll develop a state action plan with specific objectives. So like for each priority, thinking about like, okay, how are we going to actually make that happen? How are we going to measure our progress towards this? And then we'll have to write up a report and submit it to HRSA in July. And so then over the next 5 years, we'll be implementing our state action plan and reporting annually on the progress. And so these are a lot of words, but basically our vision for the state action plan is to make sure that it's in alignment with all of the other maternal child health priorities and work that the Department of Public Health is carrying out, and that we are basing our plan on the right values of racial equity and family engagement. And so thinking about like, how do we include families of color and how do we make sure that we're hearing from low-income areas and rural areas in Massachusetts and not just like focused on like middle to upper class white people in the Boston area. We really want to make sure that this is representing particularly the needs of our families facing the greatest challenges in accessing healthcare. And we also want to make sure that we're talking to as many people in the Massachusetts community as possible in developing our plans. So this is sort of our timeline. So in the fall and winter, people across the department were working on looking at existing data related to health outcomes for key maternal child health populations and looked at those data to sort of frame like, okay, what are the disparities we're seeing? What are the challenges? Who is not accessing services? And then built out some priorities. So for phase 2, where we are right now, we're engaging you all and other stakeholders in order to bring these draft priorities to you and ask, do these make sense to you? Are there things we're missing? Are there things we should add? What challenges might there be in implementing these kinds of things and making sure that what we think are priorities actually match what you think are priorities? Because again, you guys are the ones who are providing these direct services to our families and young people. And so then we'll take that feedback back, and then we'll spend, April through June finalizing the state action plan. And then after it's submitted, we'll loop back and start communicating the state plan and beginning our implementation process. And that's a summary. What questions do folks have about the needs assessment process?
Yeah, there's a couple questions in the chat. So,
Yeah.
Harold, I think you raised kind of an interesting sort of like government advocacy point that we talk about a lot. So kind of understanding, what level of government are we really hearing from? And so Harold reminded us that there's also a Title V for septic systems in homes, which I think is state regulation. And then you all obviously are sharing about Title V, which is the federal Social Security Act and the Maternal and Child Health Services bill. So that's a great example of how you might see sort of something that's titled the same thing or has the same name, but it's two very different parts of government that are kind of being targeted there. So that was one question. There was a question about sort of the current funding levels in Massachusetts for this grant, and then we've been talking a lot about some of the changes that are happening in the federal government and some of the uncertainty that has caused for federal funding. So I'm sure you all don't have any more answers than anyone else does right now, but curious if this has been something that's sort of come up in some of those conversations that you all have had about the future of this grant and any of the uncertainty that might cause as well.
Yeah, great question. So in terms of the funding level, so it's one of those grants where there's a required state match. So in terms of the actual funding that we get from the federal government, it's allocated based on the percentage of children living below the poverty level in our state. So we receive around $11 million from the federal government for this grant and have received that for about 15 years. So it has been pretty stagnant. But in terms of the new administration and their whole vibe, so the funding for Title V has been appropriated through FY26. Because it's part of the Social Security Act, it has to be approved by Congress. So in terms of what's up in the air, we're not too concerned right now, particularly because several of the more controversial, I guess, to some people's items in terms of federal block grants aren't really included in this one. So, such as like abortion access, right, and things that rile people up a little bit more. So we don't know a ton of information right now beyond that. Through FY26, we will be able to maintain the funding that we have come to become very used to in Massachusetts.
That's super helpful, Maya. I think also just what you shared earlier about this being something that has existed for 100 years. So that this has been around for a while. It's not a new program. There was a question.
Sorry, I was just going to
Go
say,
ahead.
and in the last Trump administration, there were no changes to Title V at all. So just putting that out there as well.
That's really helpful context. There was a question from Camille asking about if mental health is taken into account with the physical health.
Yep, great question. And definitely, we are looking at mental health, and more broadly, behavioral health as well as physical health. So if you are interested in giving us more feedback, I see that Titus put the link in the chat. And we are looking at we would take you through a variety of our priority areas that are informed by our landscape assessment, several of which across pregnant and birthing people, young children, adolescents. We're looking at mental health across all of those different groups.
Super helpful. I don't really see any other questions in the chat right now. There's a couple offers, people that want to participate in this and are excited about sort of contributing to the focus groups. Do you want to say a little bit more about, so just should people sign up on the form, start there, and then we can, what's the best way, I guess, to get involved or have some of these focus
Yes.
group conversations?
Please feel free to sign up on via the forum. You're welcome to share the forms with your networks. If the times do not work for you, you can contact us and I can put my email in the chat. We are trying to collect feedback through, remember, but we do have to write the report. And so we're trying to wrap up our collection of feedback by like the first week of April. So we're happy to come to any, if you cannot attend one of the scheduled focus groups, we would be happy to come to any existing like Family Advisory Council or other meetings that your organization might have. But please check the scheduled focus groups first. And then if those don't work for you, you can reach me at the email in the chat.
Thanks,
And
Julia.
we'll try to
And
schedule
Titus
it.
put the times for some of the focus groups in the chat as well, so you can see those there. We got a great question from Amy Eisen, who is wondering if, as a result of this sort of 5-year needs assessment in your conversations, is there a possibility that there could be like a reallocation of funding for different programs in Massachusetts from this grant? So based on some of the inputs, so the example was like, would more funding be allocated to early intervention as an example as part of this, if you're hearing that early intervention is a huge need?
Yeah, great question. So, the way the funding and financing works, so while we work closely with early intervention and our state's WIC program, those are separate programs with like separate finances because they also get, similar to Title V, get funding from the state and the federal government. So what Title V does more so, is filling in those gaps for programs that don't have another source of funding, right? A source of stable funding. And so, yeah, we don't really, while we work closely with those programs, their funding and financing is sort of its own entity. We do, as I said, the we have a state match for Title V, and early intervention funding is considered a state match because we're working with the same sort of population. But Title V isn't really involved in reallocation of resources for programs like early intervention and WIC. One piece of the early intervention sort of services that we do connect with and support is the Early Intervention Parenting Partnerships Home Visiting Program, which supports families within the early intervention program.
Thanks, Maya. All right, I think that's all the questions in the chat right now. I'm not sure if you want to jump back into the slides. I know there's some other information there that I'm not sure if you were planning to share today or wanted to share another time too. We always post things in the follow-up folder for the 9:30 call as well, so people will have access to the slides there.
Yeah, we didn't want to inundate folks with all of the different things that we're thinking about. So, we will send out like a one-pager of what we're thinking about currently for the state action plan, so people can have that to review before the focus group. So we just hope that folks reach out and come to a focus group or reach out to Julia to find another time to connect.
That sounds perfect. Yeah. So you'll be able to see some of like the draft priorities in the slides. And then it sounds like in this one pager, you'll be able to see a summary of that as well, and then provide some of the feedback on in the focus groups. So Brian also shared, we heard an update last week from the Commonwealth Corporation, who was sharing a little bit about the Workforce Competitive Trust Fund grant, and that grant is now released. So Brian put the link in the chat, and you can see the information there. A couple more questions have come in now. So we're looking at how are we defining mental health versus behavioral health, and then does your office provide services as well as strategic leadership? So it sounds like you kind of answered that question a little bit, Maya, on how you interact with some of the like WIC and early intervention and some of the other services that exist in the state.
Yeah, so around this question of mental health and behavioral health, when we use the term behavioral health, we're also including folks with substance use disorders. We're also including folks diagnosed with autism spectrum disorder. So it's a little bit more broad than mental health. And then in terms of the focus groups and multiple languages. Yeah, we are actually going to be holding specific focus groups in specific languages. So feel free to be on the lookout for that information as well.
Perfect. So I would turn it over to the 9:30 callers, I guess. Are there any other questions for Maya or Julia, or can you think of any other groups that they might want to engage with and sort of get some feedback for these focus groups and as they're compiling their final information for the 5-year needs assessment? And then Titus, I don't know if you want to add anything else about from the chat there. I don't know if I missed anything.
No, just I encourage people to check out the focus groups or send feedback to Maya and Julia and share with your networks because some of you may have partnerships or, you know, your teachers or your networks might be especially interested in these issues. So do what you can to spread the word.
Sounds great. And as I mentioned, we'll put all of this in the 9:30 call follow-up materials folder, which I will put in the chat now just so everyone has the link to it. So you can use that to link link to your own organization's email listservs or anything else that you're using to kind of promote the focus groups in this engagement. Amy Eisen also wonders if there's a list of current Title V initiatives or if that was included in the slide deck.
Yep, that's a great question. There is a whole host of different Title V initiatives that we have right now. But if you go to the state's Title V website, you can get more information about those specific programs.
Perfect. Couple more recommendations for who to reach out to in the chat, but I think we're good there. So Maya or Julia, I'll turn it over to you for any of the last words, but thank you so much for joining us today. And I think we'll help to promote some of these focus groups and the conversations moving forward.
Yeah, thank you all so much for the time here and all the work that you're doing for children and families. And yeah, excited to talk to you all, some of you all more in these focus groups.
Perfect. All right. Have a great weekend, everyone, and we'll see you next week on the 9:30 call. Lots of thank yous in the chat. So thank you, Maya and Julia, for joining us today. This was great.
Awesome. Thank you all.
Yeah.
Have
Thank
a
you so
good
much for
one.
your time.
All right. See ya.
Take care.